about to listen to the Dr. Daliah Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Daliah Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Daliah.
All right, we are back on the Dr. Daliah Show, 1-877-Dr. Daliah, 1-877-DOCDALI. So a term that has been thrown around a lot is borderline alcoholic. And I've had patients tell me, I'm not alcoholic, but I'm borderline. Do we have a definition of that? A definition of borderline alcoholic? And I don't like the term alcoholic. I don't like describing somebody based on an issue that they have. Like, I don't think somebody's a blonde, or somebody is a diabetic, or somebody, they have diabetes, they have blonde hair. I mean, you also have seen my blonde hair. Sometimes it changes depending on the box, right? So, it's not supposed to be a permanent descriptor. Meaning, if somebody drinks alcohol, there is that ability and optimism that they can cut back or not become a quote-unquote alcoholic. But borderline alcoholism is something that I think is not discussed enough and is very prevalent. So it's basically when somebody is close to being a quote-unquote alcoholic or drinking excessive amounts of alcohol or dependent on alcohol or gaining tolerance to alcohol, and they're on the verge and they're hence borderline. And so that could happen if you binge drink. That could happen if you socialize often, if you drink to go to sleep. And I think many individuals don't realize that they're drinking too much. And we've spoken about this on our show, where, for an adult, you're not supposed to have more than a man 2 drinks a day, a female 1 drink a day. And then in terms of binge drinking, within a 2-hour period, no more than 4 drinks for a female, 5 for a male. And on Super Bowl, you could very easily, binge drink. On New Year's, you could binge drink. At an office Christmas party, you could binge drink. And so we, don't realize that some of our behaviors could be very, very concerning from an alcohol standpoint. But when people hear the guidelines, they'll say, okay, well, that's not me. I don't drink every day. All right, good. You don't drink alcohol every day, even though in Europe, and in some cardiology circles, they're talking about a glass of wine every day. We're not ready based on cancer risk and liver risk and GI risk and heart risk to say you could drink every day. But when you tell yourself, all right, I don't drink every day, and somebody will tell me that, I'm like, okay, good, that's good, that's good. When do you drink? Do you drink socially? And when you do drink socially, what do you do? Well, my friends always like to do a shot, and then I might pre-drink so the shot doesn't hit me that hard, and then I might order, a margarita or a mojito or a Cosmo, and then as long as we don't do another shot, that's it. Well, if you're a female, that's 3 drinks, which could be roughly in a short period of time, so that could be excessive. Just because you don't drink during the week, but you drink like that on the weekend, that could be excessive. What if there's many of you who cook and you like to cook with wine, you like to have an after dinner drink, so you come home, you open the bottle of wine, you don't want to waste the whole bottle. Between you and your spouse, your partner, you aren't really going to be able to stick it in the fridge. So you're like, well, I'm going to cook with it, and I might as well have a glass while I'm cooking, wind down from work. Then you're cooking, you cook with some wine, you have another glass. Now with dinner, you have a glass. And then you're like, well, let's finish the bottle. And after dinner, while watching TV, you finish the rest of the bottle. Well, again, that could be excessive. That's more than 1 drink. I've also seen the size of the goblets people are using. When I go to my friend's house, I'm like, now that's not a wine goblet, that's a fish bowl. So when you're having a glass of wine, how big is it? How small is it? 4 ounces, 6 ounces, 8 ounces. And so when you do go out for a drink and the bartender uses the shot, to show, but then he pours more, so it looks like you're getting some more. Well, that all counts. And so I do believe there's many people who are borderline alcoholics. Other people who might not realize they're borderline alcoholic is they come home, they hardly drink at all, through the day, but then it's nighttime and they want to go to bed. They can't sleep, so they pour themselves some scotch. And it's more than a shot and a half, maybe 2 shots. And so it's very easy to start racking up your alcohol. And as a physician, I worry about the calories. I worry about your stomachs, your liver, heart. And so I just want you to be aware. And it's very, very easy on holidays and on game. We got the playoffs. I'll ask my friends where they're watching, and they're like, well, we're going to our buddy's house, or we're doing this, or we're doing this. Yeah. And if they're drinking every 2 nights when there's a game, that adds up. And it's very interesting because a lot of my friends are now in, middle age, and they're doing dry January, dry February, dry March, dry April, dry May, dry June, and they're cutting back on alcohol. And I always ask why. Were you diagnosed with diabetes? I'm very nosy with my friends. Tell me what it is. Some of it's because of the calories. Others, they say it's because I'm not sleeping well. The alcohol interferes with my sleep. Others, it's because they go, I really think I'm drinking too much. I didn't realize how much I'm drinking. So if you're going out Friday night, you're going out Saturday night, there's a game on Sunday, you cook during the week with alcohol, that could just be quote unquote too much. And even though we talked about the more than 1 drink a day for women, or 2 drinks a day for men, or more than 4 drinks in a 2-hour period for women, or 5 drinks in a 3-hour period for men, or in a 2-hour period for men, too much sometimes is picked up instinctively. When you feel like you have to hide it, when you feel like you have to lie about it, if you get annoyed that somebody is asking you about it, if you have to wake up and you need alcohol to wake up and get yourself going in the day, those are signs you could be drinking too much. And I don't want to, panic any of you, but just take a look. Just write down, maybe have a little pad of paper, do a little tally, and mark down how many drinks. Kind of be aware of the shots if you're drinking shots, the size of the glasses, and see if you can cut that back. I understand you don't want to waste a bottle, but that's another problem. A bottle of wine, a nice one, is expensive. And to throw it out because you want to stop at 1 glass, maybe you need to rethink the wine. Or figure out a way where you could save it for another day. And I get that because I don't like to throw out food. That's me. I hear you. But your people are unfortunately consuming more than they need to. 1-877 out Dali, 1-877-DOCDALI.
Let's see, if something costs less, but people are happier with it, that sounds like something to look into, and that's MediShare. Maybe you've heard switching to MediShare to pay for healthcare can save the typical family $500 a month, and that's huge, but it's also true that people are way more satisfied after making the switch, too. The customer satisfaction rate for MediShare is double that of the typical health insurance plan. Double. MediShare works. It's been around for more than a quarter century, and members have shared more than $3 billion of each other's bills. People love having telehealth and a huge nationwide PPO network. So, yeah, you can save a ton and like it better. Imagine being happy with how you're taking care of your health care. So if you're self-employed or part of the gig economy, or you just want a plan you're happy with, you can call right now and get a price within 2 minutes. A very, very smart use of 2 minutes. Here's the number you need. 855-SHARE-40. That's 855-SHARE-40. 855-SHARE-40.
Hey guys, it's Dr. Daliah. Fantasy football season is coming, but sadly, too many of you are taking the bench while the country takes part in one of the most exciting and lucrative industries out there. Don't know how to play? Well, huddle up and listen. Paul Kalikas and I have written a fantasy football pocket guide for beginners. This book walks you through the basics and shows you how simple and lucrative joining or creating a fantasy football team can be. Read our Fantasy Football Pocket Guide for Beginners found on Amazon, or follow the links on X and Facebook. That's Fantasy Football Pocket Guides for Beginners. Don't be left out.
In a study, it was found that 33% of 44 herbal supplements had no trace of the advertised herb. Don't let that happen to you. Hi, this is Dr. Mitch. If you want to ensure quality, please go to TotalWellness.com. Supplements made for physicians, only now available to you too. TotalWellness.com, helping you to look good, feel good, and enjoy total wellness.
We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-Doc-Dolly, 1-877-DOCDALI. Big thanks to Talk Media Network for making the show happen, and big thanks to Daniel, our producer. Don't forget to follow us on Twitter, on X, Facebook, The Dr. Daliah Show, and on YouTube. Don't forget to click like and subscribe. So there's a fine balance between bedside manner and saying things that are just stupid or inappropriate. And I saw this article that I thought was kind of fascinating. It's called 23 Weird, Wild, and Downright Hilarious Things Medical Professionals Have Said to Their Patients. Now, this is being written by BuzzFeed. And I guess a Redditor had asked, what's the weirdest thing a medical professional has casually said to you? And I looked at some of these things. Some of these things are completely inappropriate, and some of these things are really, what? And I had no idea doctors were doing this. You know, I like to make jokes. I like to be funny. I like to lighten the mood. But, if your doctor is saying anything inappropriate, it starts to make you question their professionalism. It starts to make you question if they don't have good judgment on what to say in terms of a joke, are they going to be making good judgment with my life? So here's some of the examples. Okay, one said, my surgeon during surgery to replace pins in my broken finger that had been pushed out of my own body said, I'm really getting them in there this time, you little freak of nature. Now, I wouldn't be insulted if somebody called me a freak of nature because my body pushed out the pins, but somebody thought that was odd enough to tell others. We don't use the word freak anymore. That's not politically correct. Another person said, I was living in a foreign country and had a cold flu type illness. I went to the doctor and he comes in eating a bowl of cereal. He looks at me and says, do you know what AIDS is? I'm in shock and I say, yes, I do. He follows up with, that's a virus, there's no cure. Then he says, but you don't have that virus, you have a different one. Much more common and treatable, but I wanted you to understand why an antibiotic would work. So that's odd. And then he walks out with his bowl of cereal. And I don't know what country this was in, but, I get a lot of doctors are frustrated because people ask for antibiotics when they have a virus, but you don't scare the person by starting to bring up AIDS and do that while eating food. That's not very sanitary. Another person said, I went in for my checkup 6 weeks after my second kid, and the intern who was overshadowing my OB-GYN said, oh, hey, you're looking great. Not to my face, but to the bottom half of me. Now, I could speak for a lot of interns and students and residents. They get nervous. And they sometimes don't know what to say. And so when they're examining to avoid the awkward silence, they're like, this looks good. Everything looks great down here. So far, so good. I'm taking some cultures, but some people might not understand that they're just trying to minimize the awkward silence. Gynecologists and the students and the interns obviously have to perfect that before they go into practice. Following a checkup, somebody was told, we're going to have to remove your testicles. Just kidding. You should have seen your face. Okay, that's not funny. That's telling somebody you have to remove their testicles. That's not funny. There's other ways to show bedside manner and to, lighten up the mood. Another one said, I was told, whoops, I'm going to have a kind of tack it on. It'll probably hold. This was after they, I guess, lost a fingertip. And then when a medical professional came up to them and said, oh, wow, they saved the finger. We were sure you were going to lose it. We even placed bets. Now, I understand some people think it's funny to tell patients that they placed bets, but patients don't think that's funny. All right. They want to think the doctors are doing nothing but helping people, not sitting there thinking they're going to make money on their own ailments. Another person said, my gynecological surgeon said, if you ever tried to have a baby, the kid would snap your pelvis in two and rip you in half. Okay, that's not even medically accurate. That makes no sense. I don't know why a gynecologist would say that. Another one said, if you don't mind, I'd like to show everyone pictures of your tonsils. According to her, I had the most disgusting tonsils she had ever seen in the years of business, and she wanted to show them off. Now, something like that, we as physicians, if you have something that could be a teaching moment for somebody else, where we call in a medical student or we ask another provider. I know on Friends, they have that episode where that doctor was like, hey, I need you to see this. And everybody was in the room looking at Ross's thing that he had on his backside. But it's a doctor asking you if they can take a picture. They have to get consent, written permission. There's forms for that. But it's you can say no at any time. But it shouldn't be construed as an insult because oftentimes in medicine it's an evolving science, and sometimes we want to learn. And if it'll teach somebody and help save lives, we're going to ask it. You're free to say no, but don't be insulted by that. They said, my previous OB-GYN came through my line at my old job. For some reason, I blanked out on who he was. Like I knew him, but for the life of me, they said I couldn't remember how. So he said, don't remember me? I'll give you a hint. He says, last time I saw you, you were in my office with your ankles in the air. He said it loudly in front of a line of people from church wanting to buy flowers from the garden center. Completely inappropriate. That's inappropriate. And I don't know how true some of these are, but these are reports of what people have said that doctors have said. One said when I was younger, I was getting stitches after a skin lump removal on my leg. The doctor and the nurse started to comment on how elastic my skin was and how nice it was to have young skin. So with something like that, sometimes your doctor is going to compliment you. And you might not be ready for that. And so it's, you don't want to feel like the doctor and the nurse are jealous of you. But having skin that bounces back and heals nicely, might be commented on. You have great skin, you have elasticity, explaining how when you're young. So, I don't think that's very, very weird or insulting, but, medical professionals should at least preface why. Say, look, I'm teaching you something here. Somebody said, if you want to help people, don't go into medicine. As a doctor, I'm nothing more than a people mechanic. And like a car mechanic, I patch people back together well enough to get them out the door until I see them again. If I could go back, I'd run as far away from medicine as I could. So this is what a doctor told somebody. And, when your doctor tells you they don't want to be a doctor, probably it's time to get a new doctor. Listen, doctors get burned out. When patients would ask me how I was doing, and I'm like, I'm doing great, to test the temperature of the room, see, yeah, because they could see the ambulance outside. They could see that some patients, were, barking at the nurse and whatever. And they were like, Daliah, look, I'm here for you. What do you need? I'm like, well, good. It's all good. We're good. But, if a physician is burnt out and doesn't like their job and calls himself as a people mechanic, I as a doctor, I'm not a people mechanic. I don't look at myself as a fixer. I don't look at myself as, a lord. I look at myself as an educator. I educate people and I try to help them. That's what you do. You do the best you can. And maybe, maybe people are putting the wrong pressures on themselves. Somebody said, wow, you have the flattest feet I've ever seen. You don't really necessarily have to say that, but, Okay, what about dentists? Somebody said when I was 12, I had a dentist say, hold on, I think I might be counting wrong. You shouldn't have those yet. Okay, never mind. Those are definitely your wisdom teeth. Your mouth is just huge, I guess. All right, that's okay. Don't tell somebody they have a big mouth. Look, I got a big mouth. I'm tired of people telling me I have a big mouth. But again, if you are unique and that your wisdom teeth came in and they want to show other people, you can say, look, this is unique. You have wisdom teeth coming in earlier than expected. Do you mind if I show my colleagues this? Nothing to worry about. It's just, this is very cool. That's how I would say it. One doctor said, my son is about your age and single. Do you want his number? And this doctor was the gynecologist. You do not try and set up family members with your patients after that. That's just absolutely no. That's ridiculous. Now, somebody said, for my mom, she's in remission from non-Hodgkin's lymphoma that invaded her brain. She was getting a scan to confirm the cancer had left her brain. The doctor came in and said, good news, we've scanned your brain and can confirm that there's nothing in there. Now, a doctor will say that in terms of relating to the cancer, but I can see how somebody thought, so I don't have a brain. So a doctor should be very, specific and say, we do not see cancer spread to the brain. And usually they're pretty good about that. Somebody said, you just hang on right there and we will get you a wheelchair and admit it to the hospital. We have to do a colonoscopy, but don't worry, I will knock you out before sticking a camera up your ass. That's what a doctor said to a patient, allegedly, or a staff. No. When we do a colonoscopy, that's not what we say. Come on, people. 1-877-Daliah. Let us know what inappropriate things have been said to you in a medical office. 1-877-DOCDALI.
Hi guys, Dr. Daliah here. Addictions can sneak up on us and come in many forms, whether it's drugs, alcohol, sex, video games, porn, or something less obvious such as food, internet, or shopping. Addiction can seem innocent at first and then evolve into an insurmountable evil. In our book, Addiction Basics, Caitlin Kalikas and I dive into the common addictions and provide tips for identifying and preventing these before they sneak in and take over our lives. Addiction Basics can be found on Amazon or my website, drdaliah.com. Check it out.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-Daliah, 1-877-DOCDALI. So I've said for years, every child should be CPR trained. Every adult should be CPR trained. This is something that should be taught in schools, workplace. There should be nobody on this planet that's not CPR certified. Well, a interesting study has come out saying half of Americans are not equipped to provide life-saving treatment in a crisis. And I'm surprised that it's only that number. I would think it's even more, because the average person I know is not trained. And in this study by Ohio State University Wexner Medical Center, they surveyed a national sample of 1,000 Americans and said only 51% of them know how to do CPR. In case of serious bleeding, only 49% said they could assist. 56% said they could help somebody if they're choking, but 44% couldn't. This data was collected via phone and email from April 5th to April 7th. So according to Dr. Nicholas Kamen, said the key takeaways from our survey was that patient outcomes would improve if the general public learned some basic life-saving measures in the areas of hands-only CPR, choking, rescue, and bleeding control. Dr. Kamen is an emergency medicine physician at Ohio State Wexner Medical Center, and he told this to Fox News Digital. So data shows that 70 to 80% of cardiac arrests occur in the home, 20% happen in a public place. So oftentimes, you could possibly save a life if you see a bystander, suffer. When I'm on a plane, I can't tell you how many times I've heard, is there a doctor on board? We have an issue we would like some assistance with, and then I get back there and I help. And thank God I'm a physician, but the average person looks scared to death, like, what do we do? And if there's an issue in your home, calling 911 is the first thing you should do, yes, but what if it takes them 7 minutes, 10 minutes? So, you need to learn. And I think all kids need to learn. This could be easily taught in schools. Some of the BS these kids are learning in schools, honestly, but let me teach you guys some quick CPR techniques, okay? So with adult, kids, pets, you need to know there's a little difference in them, but still, it's about making sure we are getting the heart and the brain as much oxygen as possible. And so there's hands-only CPR where you don't have to do the rescue breaths, but that doesn't mean CPR has changed. Just because we have a hands-only, so you don't have to put your mouth on the person, doesn't mean You don't do it if you want to. If you can do rescue breaths, please. But the first thing you do, obviously, is check to make sure you're safe and the person is safe. Form an initial impression. If you have personal protective equipment, obviously use that. But if a person is unresponsive, you always check, hello, hello. If they are unresponsive, right, you are going to have to call 911. Call 911 or assign somebody to call 911. Document the time, have them document the time, make sure you have help if you do, and then get ready to start doing CPR. You kneel behind the person, place the person on their back on a firm, flat surface. I know it's difficult because sometimes you find them on a bed, and if they're on a bed and you do chest compressions, they go, but if you can't move the person, don't move the person. Just, you've called 911, now try to do chest compressions. You will give 30 chest compressions. Your hands are 2 hands centered along the chest. Right? Basically, what you do is you find the mid-nipple area to put your palm, and then you interlock your fingers of the other hand. And you want your shoulders directly over your hands. You don't want to do it at an angle. You want to try to be directly above them. And when you compress for an adult about 2 inches. And you do it to the rate of about 100 to 120 beats a minute. If you don't know what that rate is, just sing to yourself, staying alive. Staying alive, staying alive. Stay alive. Okay, and that is pretty much the bump, bump, bump. That is the speed. Another one bites dust. Another one bites dust. Another one bites. And so that sort of tempo is how you would do it. And then when you do the beats, make sure the chest recoils back to a normal position before the next compression. Then you give 2 breaths. After 30 chest compressions, you give 2 breaths. You open the airway to a kind of a neutral position, head, tilt, chin, lift, pinch the nose, take a normal breath, make a complete seal over the person's mouth with your mouth, ensure the breath lasts at least a second, watch to see the chest rise, allowing air to exit before you give the next breath. If the first breath does not cause the chest to rise, re-tilt the head, ensure a proper seal, give the second breath. If the second breath is not making the chest rise, it could be that there's an object blocking the airway. Go back to doing the chest compressions. There's oxygen in the blood still. So you want to keep circulating that, because if the heart's not pumping, they're not getting the blood. And again, hopefully the paramedics are on their way. In terms of a baby or child, again, it depends on their size. You still want to shout, see if they're responsive. Still want to call 911. Okay? And then don't let a lot of time go by. For a baby, again, they need to be on their backs. So for a kid, have them on their backs. Kneel beside the child, and then you want to give 30 compressions. For a child that's kind of an older child, you'll do the 2 compressions. You'll probably go about maybe an inch and a half. If it's a small child, you might only use one-handed technique, the heel of one hand. And then for a baby, you'll place both thumbs on the center of the baby's chest, just below the nipple line. And then you'll press about an inch and a half to the rate of 100 to 120 beats a minute. You could also do the 2-finger technique. You don't want to crush the baby's chest with 2 hands. That's why you would do the 2 fingers, or you would do the thumbs. And for a young child, you could do the 1 hand. And then, of course, 2 breaths. If you could do the breathing, do it. 30 compressions, 2 breaths. 30 compressions, 2 breaths. With the breaths, again, head tilt, chin lift. For a baby, make sure the airway, again, in neutral position. Try to do the head tilt, chin lift, and then blow for about a second. Watch to see the chest rise. Allow the air to exit before the second one. And then also with CPR, you want to make sure you have an AED ready to use. AEDs give you directions on where to put the pads, how to charge, telling everybody to clear the area. Again, if you're on the scene by yourself and there's no paramedics. Now, when the paramedics do come, get the hell out of the way. when they tell you to. So what you'll do is you'll continue doing CPR, and then the paramedic will tap you on the shoulder and say, "We will take over." Now, you will get tired. I know you see it in the movies and it looks all great and grand. You can get tired. So when you have people that offer to help, don't say, "I got this, go somewhere else." You better plan on having somebody, if anybody wants to help, make sure you have somebody strong and say, "Look, do you fatigue easily? Because I'm going to need you to take over soon." If you have multiple people, after 911 is called, you can have somebody direct the paramedics, etc. But if you're by yourself, understand that this could be exhausting, which is another reason why I like the breath and compressions, because when you breathe, it gives your arms a chance to rest for a second or two. But if you don't want to put your mouth on the patient, then fine, you'll do the compression only. And then for cats and dogs, of course, you might have to do chest compressions on them. I have shown you how to do that on my dog. Uzi allowed us to do a video showing how to do CPR. Again, 100 to 120 compressions a minute. You would compress a third to a half the width of your pet's chest, giving rescue breaths as well. All right, hope you guys learned something. But we all should know how to do CPR. 1-877-DOC-DALI, 1-877-DOC-DALI.
Considered by most, optimized curcumin is one of the few bioavailable and highly absorbable curcumin products on the market. Hi, I'm Dr. Mitch. Since most chronic diseases have inflammation, our optimized curcumin seems to be a perfect addition to any nutritional program. It makes sense to me that preventing or reducing inflammation is a key component to our overall health. The Mayo Clinic found that curcumin can decrease swelling and inflammation, has antioxidant properties, and research suggests that curcumin can prevent cancer, or at least slow the spread of cancer, and in many instances make chemotherapy more effective. It protects our healthy cells even from radiation. TotalWellness.com, where we help you to look good, feel good, and enjoy total wellness.
Self-reliance. It's not a phrase we hear much in our culture these days. It might conjure up images of pioneers, the West, rifles, strapping men, and strong women. But what does it mean for us in today's world? The New American Magazine has just released its latest collector's edition, Self-Reliance, Foundation of Freedom. In it, the New American authors outline the necessity of self-reliance for a free people, tips for self-reliant living, and the importance of not giving up hope. This unique edition includes articles on the self-sufficiency of the founders, preparing for a worst-case scenario, firearms, financial self-reliance, the importance of community, and many other topics by expert writers. Now, for a limited time, the New American is offering a bundle of 3 collector's editions, Self-Reliance, The Great Reset, and Trump World, for just $19.95. Available at shopjbs.org. Visit shopjbs.org today.
We are back on the Dr. Daliah Show, 1-877-DOC-DALI, 1-877-DOC-DALI. So one of you had brought up how, medicine is about making money, and society is trying to make you think you're sick so that more money gets spent. Now, I kind of see society as doing the opposite. Not wanting you to get treated, not wanting to use up a hospital bed, wanting you to leave this earth sooner than later because of population. And so, I see the other trend, which is scary. And I think there should be a happy medium. But are many of you feeling like we in medicine are trying to tell you something's wrong so that you spend more money? That's horrible if that's what's happening. Now, if you're getting that feeling because of the ads, where you see pharmaceutical ads, getting that feeling because of the vaccine mandates. I don't blame you. It looks like a lot of marketing. It does. But, if I could, not defend a pharmaceutical company, but explain in terms of that, if you need a drug and you need a medication, you need it. And a pharmaceutical company would rather you use their drugs than somebody else because then they make the money. So yes, there is, supply and demand, there's profits, etc. But a company will not do well if you're using a drug you don't need. Because now if you're addicted, you could sue that company, like we saw with the opioid crisis. If you get a side effect, you could sue. And so pharmaceutical companies are very diligent on saying, don't use this if you don't have the symptoms. And if you are using it more than 3 days, a week, 2 weeks, consult a medical provider. So I think now there's been so much liability that a company that makes an antiarrhythmic is not going to be telling you and goading you into taking it when you don't need it. But what I think we do need to have honest conversations about is, are you, how ignorance is bliss, where we think we're feeling fine. So we're like, well, nothing's wrong. And if I don't think about it, it's not happening. But we do have something deeper going on. I told you, if you go upstairs and you feel winded and you need to catch your breath, that could be a sign of a heart issue. It could also be a sign you're out of shape, but it could be a sign that there's a heart issue. If you need Viagra or erectile dysfunction medication, that could mean you're having a heart issue. Because if you're having poor blood flow to the penis, you could be having poor blood flow to the heart. If you're having memory issues, that could be a sign of early dementia. It could be a sign of anxiety, depression. This is an interesting article. According to Metro, 16 signs your body is telling you something's wrong and you shouldn't ignore. And I don't think these articles are necessarily trying to push you to spending money. I love these articles that teach you not to ignore a symptom. Earlier this month, I told you about that new patient of mine that came in asking for nasal steroid spray refill because he always had postnasal drip. And when I examined him, I saw a tumor at the bottom of his tongue, at the base of his tongue. And so, I don't want you to continually be using something and misdiagnosing yourself when you could have possibly another condition. So I'm always for education. You make the decision about what to buy, what to proceed, and what to do, but the education should still be out there. So one thing that they talk about is dry eyes. If you have dry eyes, that could be a sign that something's wrong. It could be autoimmune disease like Sjogren's syndrome, which is inflammation of tear-secreting glands. It could be an issue that you're staring at screens too much, thyroid eye disease. So if you have dry eyes, don't just be putting saline eye drops. Get it checked out. If you have ridges on your fingernails, fingernails can tell a lot about your health. But ridges could be a sign that you have a nutrient deficiency or a vitamin deficiency. A, B, C, D, E vitamins, zinc, selenium. Sometimes nail ridges could be a sign of lung disease because of low oxygen affecting the way your nails are growing. If you have black or dark spots underneath the nail, that could be a sign of melanoma. If you have fungus in your nails, that could be a sign also of diabetes. So definitely get that looked at. Do not ignore your nails. White patches inside your mouth, right? Gums, cheeks. It could be something called leukoplakia, which is painless, but these white spots could be a precursor to cancer, especially if you drink alcohol, chew tobacco, use tobacco. So any sort of lesions in the mouth, you got to get that checked out. I have a lot of patients that tell me they always feel cold. The first thing I like to check is if they have a thyroid issue. Then I also like to check if they have anemia. But sometimes it could also be autoimmune, like Raynaud's phenomenon. If you feel cold, it could be a vasculature issue, the blood's not pumping where it needs to be, or an issue with your thermodynamics and the brain. So if you always feel cold, you got to get that checked out. Intense dreams could be an issue. Intense dreams could be a sign of sleep apnea, not enough oxygen, anxiety, depression, could even be a sign of Parkinson's. So just because something happens in your sleep doesn't mean to ignore it. It's got to get checked out. If your hands or fingers get blue or white or change color or go red, white, and blue in the cold, that could be a sign of Raynaud's disease, where you have arteries that narrow as a response to the cold. You don't want that because then your tips of your fingers, your nose, your penis, your ears might not be getting enough blood flow. So you got to get that checked out. Another thing that people seem to ignore is when they get brain fog. They feel spacey. Yeah, COVID could do that to us, but that could also be a sign of blood flow to the brain. It could be a sign of arrhythmia. It could be a sign of a thyroid issue. So if you feel foggy, you got to get that checked out. If you're always bloated, when you feel bloated and feel like you always need to widen your pants, if you have ovaries, you got to get that looked at. If you have bowel issues, if you have, you got to get the colon looked at, look at your food intolerances, but always having bloating, you got to get that checked out, especially if you're a female. Some people will notice that they're puffy. They have swelling. They go, yeah, I was on my feet all day. Okay, if you have swelling in your legs or hands or feet, that could be a sign of peripheral vascular disease, issues with your veins, issues with your arteries. It could be an issue with your heart. Your heart might not be pumping well enough, so you get the backflow and the back pressure. Could be a sign of kidney issues, liver issues. Do not ignore swelling. Another thing that seems to happen to people, which I think is a sign that you need to get checked out, is hair loss. Now, as we age, we lose our hair. That happens. But if your hair loss is premature, or if it's a lot, that could be a sign of diabetes, anemia, hormone changes, stress. It could also be a sign that you're not healthy. Another thing I don't want you to blow off is certain discolorations of your skin. If you get weird moles or weird patches on your body that you used to not have, that could be a sign that something's going on internally. So get yourself checked out. A sour or bitter taste in your mouth. That could be a sign of GERD, gastroesophageal reflux disease. If you feel like you have bad breath or you're always tasting acid, then that means other parts of your body, like other parts of your GI system, could be getting exposed to acid. We don't want your throat, your tongue, your esophagus getting exposed to acid. Losing your sense of smell, I think, is very important. It used to signify that you could have a brain lesion, a mass, Parkinson's. Now that we know COVID does it, we're a little more relaxed, but that doesn't mean it should be blown off. If you can't smell and you still can't smell, you got to get that checked out. If your muscles twitch, that could be a sign that your calcium is off, or you have a motor neuron disease or something neurological. So get that looked at. Let's say you're thirsty. I know it's hot outside, but you're thirsty. Well, a lot of thirst could be a sign of diabetes, high blood pressure, other sorts of issues. If you're always itchy, you feel like you itch, eczema could do it, yeah, but also liver disease, renal disease, diabetes, thyroid problems. So I don't want to worry you guys, but if you have any of these symptoms, you definitely have to get it checked out. 1-877-DOC-DALI, 1-877-DOC-DALI.
Did you know that healthy arteries make a gas? Yes, actually 3 known gases. Hi, I'm Dr. Mitch, and nitric oxide is a gas that's readily made all day long to keep our arteries open by relaxing the blood vessel walls. By doing this, our circulation is increased, bringing blood, oxygen, and nutrients to every part of your body. Both age and poor diet can lead to a loss of this precious gas, and in turn, blood pressure can go up, energy can go down, and you can get tingling in your hands and feet. Well, our product, Ultimate Nitric Oxide, can easily help fix this lack of nitric oxide. Go to TotalWellness.com. That's TotalWellness.com, where we are helping you to look good, feel good, and enjoy total wellness.